This middle-aged patient has a large ventral hernia. A ventral hernia is a hernia along the anterior abdominal wall. Sonography is an excellent tool for diagnosing ventral hernias. Here we can see the hernial sac protruding through a defect in the anterior abdominal wall. The defect in the anterior abdominal wall in this patient measures 2 centimeters in diameter. However, the hernial sac measures 7 by 5 centimeters in diameter. Despite the large size of the hernial sac, there is no evidence of bowel within the hernial sac. Rather, it contains omental fat. To study the movement of hernial contents to and fro through the defect in the anterior abdominal wall, we can ask the patient to cough or to strain using the Valsalva maneuver. Such large hernias do not respond well to conservative management and support. Hence, surgery may be the only option. The danger of strangulation of the hernial contents is a very real possibility. There are primarily 3 types of ventral hernias. It can be incisional hernia, it can be an epigastric hernia, or it can be an umbilical hernia. Ventral hernias gradually increase in size with the passage of time, hence conservative management may not be very helpful. In women, the commonest cause of a ventral hernia is an incisional hernia following childbirth and cesarean section. Chronic cough and constipation are also common causes of a ventral hernia. Any surgery on the anterior abdominal wall can also cause a weakness which can develop into a ventral hernia. In fact, 30% of patients who had an abdominal surgery would develop an incisional hernia at some future date. Use of a high-frequency transducer shows details of the contents of the hernia, especially for bowel, etc. However, a convex probe is more useful in studying the extent of the hernia due to its large size, as in this case. Here we can see absence of any bowel gas, ruling out the presence of intestinal content. Here we can see that the hernia is pretty large at more than 5 by 7 centimeters.